Hello, my name is Ashlynn E. My topic is on Civil War medicine and surgeries. I am a nursing student, and so the medical and surgical aspects of the Civil War really interest me, and it's what drove me to choose this topic. The first thing I'm going to talk about is common illnesses and injuries in the Civil War. The first thing is yellow fever. This is a mosquito-transmitted disease. It has no known treatments or antidotes. It can be prevented with vaccines, mosquito repellent, and protective clothing. During the war, we did not have mosquito repellent or the vaccines developed. We did have somewhat protective clothing. They had long sleeves and long pants. The jackets were made of wool and they were really heavy and hot. A lot of times the soldiers would take these off. They didn't really have the full protection they really needed specifically for the yellow fever. The second thing is malaria. This is also a mosquito-transmitted disease, and it gave flu-like symptoms. Today we know the treatment is anti-malarials such as Plaquenil, and this wasn't developed until after the war, so really they focused their treatment towards symptomatic relief and comfort care measures towards the flu-like symptoms. The third thing being scurvy. This is a vitamin C deficiency. The Union troops actually had the railroad system where they could transport their fruits and vegetables and manufactured foods to their soldiers wherever they were at, and so they actually got all their essential vitamins and nutrients to prevent scurvy, whereas the Confederate troops actually farmed and grew their own food. And during the last year of the war, the whole Virginia countryside was actually depleted of their food, and so they actually had increased rates of scurvy, morbidity and mortality rates during the last year of the war. Dysentery, this is a form of gastroenteritis. It's inflammation of the colon. Its signs and symptoms were bloody diarrhea and mucus in the feces. And we know that with the frequent diarrhea, they lost lots of potassium and fluids. So a lot of the treatment was based on rehydration and rest. Today we know it can be treated with antimicrobials such as azithromycin, but it was not developed until after the war also. Some of the common injuries were from gunshots, cutlasses, shrapnel, cannon shots, and bayonets. Statistics show that the medical corps treated a total of 6 million illnesses, but only 425,000 were battle-related injuries. 2 out of 3 fatalities came from disease rather than wounds. So whenever you think about the Civil War, most people assume that majority of the fatalities were from battle-related complications like gunshots, cannon shots, things like that, but the research shows that a lot of these fatalities came from the disease. And, during the Civil War, we did not know much about bacteria, aseptic technique. We didn't know to sterilize our equipment between different surgeries or how to sterilize. We didn't know the proper hand washing techniques. So, we had lots of gangrene and bacterial complications that the soldiers suffered from. And usually if you didn't die on the battlefield from these things, the complications from it would get you eventually. Amputations and surgeries. This is an actual picture from the Civil War. This soldier has had a right below the ankle amputation, and this would be the doctor holding a rag over his face. The rag is chloroform. This is actually what the bottle looked like during the war. They would soak the rag in it and put it over the soldier's face, and it's kind of like our modern day anesthesia. It would put them under where they won't alert and oriented throughout the whole thing. They also used alcohol. This was mostly for, if you ingest in large amounts, it would be for sedation, but pain relief also. You were lucky if you got these two, especially with the Confederates soldiers. They really didn't have any as much as the Union troops. If they didn't, the surgeon would instruct about 6 large men just to hold the soldier down, and he would do the amputation while he was alert and oriented, and it was really rough on them. This is a wagon. It's the medical wagon pulled by horses, and they would pull it all across America and had all the tools for the amputations, different things, and if it did, it would have certain drugs if they had it. In their table, they would carry that around with them. Sometimes they would perform these surgeries on the battlefield or wherever they could get. That's one of the reasons why we had so many bacterial complications, because it was just, out in the open. It wasn't like today we do it in operating rooms, which are sterilized. This was just out in the open, wherever they could get. And a lot of times these surgeries were trial and error, and they didn't really have the evidence-based research like we do today, where we know what works and what doesn't work. We just kind of had to implement, you know, we need to do this now, let's do it. We didn't know what works. So it's amazing how many lives they saved doing it out in the open like that without the evidence-based research. These are two of the Confederate Army's surgical boxes. This one was mainly used for amputations. You can see it has the steel saw, different knives, and that would probably be used for probably fingers or toe amputations. It's just a smaller saw. Right here, this is called a bone duster, and whenever they actually amputated a limb, there would be small bone fragments left in there from the saw, and actually kind of like how you see sawdust come off the bone will actually do the same thing. They would use this and get those fragments out, try to cleanse it before they sew them up. With this is like their surgical string they would use to tie it up. Once they ran out of that, they would use horsehair. And horsehair, you know, it isn't sterile, which is also one of the reasons why we had so many complications, but it was cheap and it was readily available for them to use. This is a bone plier, and when you think of like a cannon shot or cannon injury, you know, it wouldn't be an approximated wound straight across. It would be more jagged, and some tissues would be left on there. So they would use the steel saw to cut the tissues, and your bone pliers would be used to cut it straight, and it would make better healing and less complications afterwards. But that is my presentation. The main thing I was wanting to go for was for you to know that we do have more fatalities from diseases rather than wounds. And many people, whenever you ask them, you know, do you think that people died from the battlefield related injuries or disease, they would tell you the battlefield wounds, but it's really the diseases, and it's because we didn't know about, you know, aseptic technique or bacteria. Many of these soldiers, they died from bacterial complications, viruses, harsh weather conditions, or any of the complications after the surgeries. But that's it. Today we, you know, in the medical field, we do look at the stuff that they did, the surgical interventions, as unsanitary or barbaric, but it did save thousands of lives, and they helped shape what we do in today's medical world. You know, we perfected it through their trial and error. So thank you for watching. I hope you learned something.